This because I'm sure this is a service that we might know somebody or be a part of this ourselves. And Brittanny, thank you so much for your time today on this Wednesday morning. Excited to talk with you.
There we go. Got to unmute myself. Hi, I'm excited to be here.
Well, and Brittanny, right off the bat, take me through your role as clinical manager with Centerstone and just what that day to day looks like for you.
Sure. So I supervise the supervisors of the therapists and counselors on our outpatient team. So I started at Centerstone as a counselor myself, and then over time, kind of grew into a leadership role. And it's a great opportunity to watch the clinicians grow, but then in the position I'm in now, I get to watch the leaders grow too, which is pretty cool.
Well, and how long has your journey been with Centerstone?
I have been there for over 11 years, believe it or not.
Wow. Well, and this is what I find fascinating is just hearing, from your perspective, how the awareness on mental health and mental health challenges, along with the services that are provided, how have you seen them kind of grow and evolve over those 11 years?
Well, when I first started, I felt like the community had a decent bit of stigma about the services and our clients that we work with. And over time, I think some of that has improved. And I think now the community sees Centerstone as a great resource. I hope, anyway. Maybe I'm biased, but I think that now our services and our clients were viewed a little differently. And we also are able to provide more broad range of services as we've grown and grown over years. So working with children, adults, substance use, mental health, folks with Medicaid, but also folks with commercial insurance. So, I think the more we broaden and grow, hopefully break some of those barriers and stigma down.
Well, and this is why I love having these conversations with you guys. We've had them for over a year now because the more I feel like we talk about it, and I tell people all the time, I've been in the counseling office and I've been, I've met with folks and I've had to, go through that journey myself. And I feel like the more that we can openly talk about this and say, hey, it's okay if you're not okay, go get the help before it gets worse. I mean, it's like, I always call us a car. You got to maintain the car and maintenance it, and I wanted to ask you too, Brittanny, in your role, what's it like seeing those supervisors, those counselors grow as, their tenure continues to grow with Centerstone?
Honestly, CJ, that's one of my very favorite things. Getting to see folks come in as I call them little baby therapists, but they come in really green or fresh from school, or maybe from a different type of work or organization, and then seeing them just grow in the types of services they're able to provide, their clinical skill set. Maybe someone first comes in and says they're most comfortable working with adults. And then over time, maybe they start working with some teens or kids or expand, attend some training and again, continue to expand who they are interested in working with. What's really cool is when someone can find something that they're passionate about or an area that they're really, really interested in. And then that's cool to see folks just light up and dive in to a certain specialty. So in the past, we've had people who pursued certification with grief counseling or trauma specific, things like that, where it just sort of lights them up to talk about it. And then similar with leaders, it's really cool to have folks start with us or maybe they started on the outpatient team or maybe on another team, but eventually, maybe they had interest in leadership and began that. And there's so much to learn. The way you do your job is one thing, but then also trying to lead others it's a whole other experience. So seeing them learn how to have difficult conversations, but with compassion, and balance the different workload as a leader it's that's awesome to see too.
Well, and honestly, what I think so incredible, really, about Centerstone as a whole is the pride that you all take in maintaining your counselors, the supervisors, and all staffs, mental health as well. Because I can only, I've talked with so many about this, the stressors of, being in that counselor role and hearing some of these really tough stories and trying to make sense of it all and really helping that patient. I'm sure it takes a toll, on the staff. And take me through what Centerstone in your position, does to really maintain that overall mental health for them.
Yes, compassion fatigue is a very real thing. So is vicarious trauma. And so when we're sitting with folks who are experiencing some of the most difficult times of their lives, um, we're people, we're human. So some of that can take a toll. And just the workload itself can be a lot to juggle. So there's a few things that Centerstone does. And then our team specifically, also, the leaders on my team are very passionate about this. And so Centerstone itself tries to provide some different things. So some opportunities for training so that you can enhance those skill sets. So you're prepared and equipped to handle the things that you're working with folks on.
That's really
But
cool.
we also have a well-being platform. It's called, I don't remember what it's called right now. It used to be called Navigate Wellbeing, but it has various challenges like, stay hydrated challenge or enter your steps.
That's cool.
There's also opportunities to talk with financial advisors. So things like this where it's looking at not just self-care through this little bitty lens of, let's throw a pizza party every now and then. But no, how are you taking care of your financial health and investing in your future? What are your career goals? How can we help you develop as a person? And then our team specifically, the leaders have developed some different things like coupons for folks. Submit this coupon and your supervisor will do 2 closures for you.
Wow.
Or head out of the office a couple hours early this week at some point. Or one of my favorite, a couple of folks pooled theirs together and had all of us on the leadership team do a rap battle.
Oh.
Because it was funny and uplifting, and it gave little things like that. I think change the work environment.
Well, and honestly, just hearing that, though, it really, I understand a little bit more of just why, because everyone I talk to just loves Centerstone and they love the mission behind it. And I think that's so important for how big your guys' organization is, number one, but also all the different spokes on the Centerstone wheel that we've been learning about. You have to have all that love and compassion and passion, for this career and in order to be successful.
Right. And, that passion is a great place to start. And I think, when folks come in the door, they're excited, they're energized. And over time, if you're not taking care of yourself or doing things to take care of yourself, that even though the work is so meaningful and we love it, it can still weigh heavy over time if we're not doing those things to be proactive.
Well, and now let's dive a little bit into this outpatient counseling service that you guys provide. I know of individuals that utilize it. For the folks that are maybe still learning a little bit more about, how the operation works at Centerstone, you guys do take both private and public insurance, correct?
Yes, that's right. So Medicaid has a lot of different names, but Medicaid and then also commercial insurances, private insurances, and Medicare as well.
And now, is there an option for somebody who maybe doesn't have any of those options that still wants to seek help, or is that kind of where things get a little tricky?
Well, it could get tricky, but there are some self-pay options that our enrollment team talks with people, and they take some information from you and look at a sliding scale. So, the service cost is one thing, but then based on income and household size, things like that, that gets adjusted to a sliding scale fee. I'll also add that some folks will look at other alternatives like integrating maybe group therapy in there because the cost of that looks a little different. So all in all, I think it's about communicating what your needs are. And then sometimes we also have grants
Right.
depending on what the person's coming in for. But we have some various grants that could assist with things like that if someone meets the criteria for that.
Well, and now I'm sure that there's a gamut and a gauntlet of folks that are utilizing outpatient of all ages. Take me through when you start to see the outpatient counseling, start to take effect in somebody. Does it start younger than, 10, or what's that age range look like for you all?
Yeah, some of our programming will go as low as 4.
Wow.
Yeah, and sadly, those services are needed and utilized that young. There are a couple of, like I said, grants or specific programs that do work with ages 4. Usually on the outpatient side, we see closer to 6.
Wow.
Folks beginning at about 6. Yeah.
Well, and now how does the evolution of that counseling session, change over the couple of years? Because, I can only imagine when you're starting to work with somebody as young as 6, there's a lot different component at play than, maybe having, that same patient 6 years later, potentially. What does that look like and sound like for that first time encounter?
Yes. So after the assessment and those more boring pieces are done and they can dive into the therapy. I mean,
be honest about it. That's the way to do it,
it is. It's not the most fun part, but it's necessary. After that, once we get all into the work, for folks who are on that younger side, we do have a play therapy room and an art therapy space. So there's play therapy available. And in that play therapy space, there's also a sand tray, which is a specific intervention as well. And so I think getting creative with folks who are younger, but I'll be honest, even working with teens and adults, we still venture into that art room sometimes, because that can, sometimes our words aren't, maybe we're not ready to speak something, but we can create in a way that helps us.
Can I ask you if it's okay to, whenever someone starts in with your guys' services that early, what is, and again, it could be a plethora of reasons. Is there, a majority or, 6 times out of 10, it's because of, X or because of Z? What do you see in those clients when they're coming in that young?
Yeah, that's a great question. I'm not sure if I could give a percentage to it off the top of my head, but anything ranging from trauma, experiencing abuse, trauma, neglect, or it could also be behavior difficulty going on. Maybe there's trouble going on at school or certain behavior that the family is having difficulty with at home. And in that situation, there is work with the family. So work with the parents as well to help reinforce the things that are happening in counseling. And then also we do see some early signs of anxiety and sadly depression as well in young kiddos at times.
Wow. Well, and honestly, it's fascinating to hear that and really just kind of educate myself and the public a little bit more of what you guys see, because sometimes I feel like if it's not in our home, we don't understand it and it's not kind of there. And it's really good to talk about that. And, for somebody that, maybe has never been to a counseling service before or, never has, taken part of therapy, and this is maybe new for them, maybe everything's been great until something happens one day that kind of throws off the whole train. What's important for that person to know, before they even make that phone call with you? Is there any bit of advice you could give them?
Well, one thing that immediately comes to mind is you don't have to wait until it gets to a certain level of toughness.
Yeah.
If whatever's going on is interfering with your life and has been, persistent, or your typical ways of coping aren't helping, you don't have to muscle through it or, try to do it on your own. Come in, please, is my urging. But alongside of that, you were also asking about, things to be prepared for. We do that assessment process, and I mentioned earlier it's boring, and so I do like folks to be a bit prepared that when you walk in our door, the very first time that you meet with someone, it's not necessarily going to be therapy right away. That
Gotcha.
very first appointment. It's also not going to be meeting with the psychiatrist or having medication that very first appointment either. And sometimes when you're in a rough spot, you really want that help as quickly as possible. And so that can be hard to adjust those expectations.
And honestly, that's great to know. And, I think something that's also been so fascinating and really informative with our segments with Centerstone has been, hearing how a lot of times, it's a little bit of both, counseling and sometimes medically assisted treatment programs that are going on and just other services that kind of go hand in hand. And, for somebody that's, when do you start to see that the real counseling start to take place? Is it, appointment 3? Do you meet with a psychologist, in a couple of weeks after, you start to get to know your counselor? What's that look like?
Yeah, that's also a great question. So the first
I don't ask very many of these.
No, you've got some good ones. The first appointment, sometimes 2, if things are either complex or if for some reason that appointment was interrupted. That first appointment or 2 is that information gathering. We're asking a lot of questions, assessing, coming up with a goal plan, and then someone then gets linked with the person they're going to be with for counseling, and begins right then. And then, as you mentioned, yes, after 3 kept appointments, then we can put in that request for the psychiatric services, which is that medication component. Now, not everyone who comes in wants or needs medication.
Right.
Sometimes counseling alone is all the person is seeking or all that's needed. But if someone is wanting or needing medication, it comes a little bit later down the line.
Well, and honestly, I think that's a really good note to make too, because maybe somebody's sitting there going, well, I don't want them to, put me on, a Prozac. You never know what it is for somebody. And to know, hey, it's your journey too. We're going to do what we can. And what I think is really fascinating too is just to learn about the evolution of that counseling session and learning about how that person and individual progresses. Do you have folks that, typically leave after, a certain set number of months, or say, hey, you know what, I'm feeling better? Or do you recommend that, hey, maybe we don't meet as frequently, but let's always catch up and see how things are looking?
Yes. So ideally, we're working with folks on the goals that are set at the beginning.
Okay.
And those could be changed. Sometimes you get into stuff and realize, I thought I needed to discuss the grief of, a most recent loss, but really there's these other things going on. So that is editable and changeable. But we're working towards those goals. And as we see progress, and I mean meaning the client and the counselor, as we together see progress over time, there should ideally be a discussion about, okay, we've been meeting every week. Let's talk about every other, or what would it look like to practice these things for the next 2 weeks or 3 weeks and come back, or month, and begin to sort of space that out. Again, it looks a little different based on what the person is coming in for, but ideally we can sort of step down the services and begin to space things out and give folks that that trial, so to say, of like, okay, what did those last 4 weeks look like without that weekly therapy anymore?
Well, and that's what I was kind of wanting to lead into too, and you're hitting it right on the head, is do you run into individuals where, I don't know what other term to use, but maybe, after a couple of months and therapy's going really good, well, why stop this train because I'm feeling really good with therapy? Does it become overly reliant upon instead of, trying for our own? And how do you manage that without saying we're here for you, but we also want to make sure that you're growing too?
Right. If as a clinician, if I if you are dependent on seeing me for the rest of your life, I don't know that I'm doing my job
Yeah.
right. Because really, my goal is to give you the tools to be able to do some of these things on your own or some of these things outside of the therapy session. Now, there are sometimes folks who have a lot of complex things going
Yeah.
on. And so maybe the number of sessions or length of time that they're in services is longer. And then someone, like you mentioned, maybe there's not something complex, maybe there's not a heavy history, but there's one particular thing going on that's been difficult.
Right.
And maybe that's a few sessions and we resolve it. But having those discussions about what does progress look like? What if we ended services, what would you need to support you continuing this? And sometimes I'll actually say oftentimes that means developing more of those informal supports. So finding other outlets for you and also finding other means of connection. Yeah.
Well, and with that too, do you ever have an experience? And I'm sure you have, maybe you haven't, where, and not just your counselors, where you have to bring in maybe the loved one or a partner or somebody that is that support system to maybe not say, hey, you're doing something wrong, but just to inform them on what those goals are and how to obtain those goals, or at least, be there too for that individual to fall back on and say, hey, I need you a little bit today.
Yes, definitely. And that really rests on the person.
Gotcha.
the person in services. Sometimes folks will say, I'm really not interested in having anyone join me. And other times people are very vocal about saying, I would love to have my partner join a few sessions so that, some of these things can be discussed. So we can map out a plan for whenever certain things happen, we can kind of come up with some safety planning or discuss what works best. Or a parent or a friend, a neighbor, whatever that might look like. I would say, especially in crisis situations when we're doing safety planning, looping in that support can be really important.
Mm-hmm.
But as part of outpatient therapy, it's something that is, is an option. A lot of times folks aren't super interested in having anyone join the session per se, but we can discuss how they can discuss how, we talk about how you talk about it with your loved one.
Well, that's really cool. And, as we're talking about outpatient, we have a couple of minutes left. It's been a great conversation, and I really appreciate your time. Is this your most utilized service at Centerstone, is outpatient, or is it something that I wouldn't suspect?
Oh, gosh. That is a great question. Probably the psychiatric services may be larger than
Makes
just
sense.
outpatient because within outpatient, some of our clients participate in the psychiatric services, right? Some folks seeking therapy also have medication, but Centerstone, we also have different levels of care. So we have some care coordination, or folks might be more familiar with case management type of services where the person may not necessarily need therapy, but they do need some help navigating getting resources in the community or signing up for and utilizing benefits. But because of what's going on with their mental health, those are barriers for them to get this. So they need someone to help kind of walk through those things with them. Well, those folks could also be using psychiatric services and might not be an outpatient. Similar with, we have another program called Family Services, and although it's very similar to outpatient, that involves clinicians who go to the school or go to the home-based services, and they may have clients who participate in psychiatric services. So I would say psychiatric care is a bigger umbrella than a lot of our programs.
Well,
crossover too.
and before I let you go, just, maybe one final question for the audience is, how long of a process does it take? Because I think sometimes, especially, for some of us, maybe most of us, that we're going back to that first part, because this is something that I connect with. I was fine until I wasn't fine. Is you want the answer right away, like you said. You want that perfect fix. Get the Band-Aid on, and let's just kind of keep moving forward. And then you realize that's not the way you kind of have to do this. But whenever we're calling for the first time, and we're setting up that assessment, how quickly can you guys start scheduling people, and how long do you think it takes to get into that counselor's office?
Yes. So if someone has Medicaid type of insurance, we have walk-in hours.
Oh, wow.
And by walk-in, I mean also call in at this point, but eventually it will be all back in person. And so the phone number for anyone interested in services is 1-877-HOPE-123. So that's 1-877-HOPE-123. And that phone number is going to get you to our customer engagement center, and they will ask questions about insurance and all of that. But if someone has Medicaid, you could call in and be added to our walk-in list for the day and be assessed. The hope is that day. If we don't get to folks that day, we do ask that they call in the next day. Maybe you can't that day because you work the next day.
Right.
So you call in Thursday instead. But Monday through Friday, we have those quote unquote walk-in hours for folks who have that type of insurance. For folks who have commercial insurance, we do scheduled appointments for those. And the reason being is just because commercial insurance, private insurances require very specific credentials. So we only have, a set number of those folks and a set number of those appointments. So those do have to be scheduled. And that they try to schedule within 14 days.
Okay.
Of calling. So if I called today, the 2nd, ideally my appointment would be sometime before the 16th. So sometime before the next 2 weeks. And that's the assessment part. And then, as I mentioned, completing that assessment and treatment plan. And then within a week, 10 days is our goal. Within 10 days that you have your first therapy appointment scheduled after that assessment. That's
really cool. And Brittanny, it's been so great talking with you today, learning a little bit more about your role in outpatient counseling services. What's your final takeaway to the audience and the region today, just over outpatient counseling in Centerstone as a whole?
Well, I said it earlier, I'll say it again, is just if you are feeling overwhelmed by whatever is going on, maybe it's a history of things, maybe it's something currently going on, but that you don't have to navigate those things related to your mental health or substance use by yourself. Come in and we can help, kind of map out with you what that looks like and help you work towards those goals.
Absolutely. Brittanny McCrady, thank you so much. Clinical manager for Centerstone. It's been a great conversation, and I hope to talk with you again soon.
Thank you so much.
It's 10:38, little bit of change. On the show once a Wednesday, we go back once a week on Wednesday. If it was once a Wednesday, that'd be pretty easy. But Lacey McDonald takes us back 100 years, and we're going to take a look back at Alton in 1925 and see what else fun we can cause in the studio. For more information on Centerstone, centerstone.org or 1-877-HOPE-123. We'll link everything in an article on RiverBender.com. Brittanny, thank you so much for your time, and we'll stay right here in the studio, and you guys hopefully will be on your screen when I come back after a brief break on RiverBender.com and Roku TV.